the chest, and you've got the lungs, and you've got the heart. The lungs have two components. They've got the tubes, the airways, and then they've got the actual lung tissue, the alveoli. And the alveoli are where, when the air comes in, it allows the carbon dioxide to come out of the body and allows us to get oxygen, without which, of course, we couldn't function. The airways allow the passage of the air in and out. Two kind of groups of diseases. You can have airways disease, as they call it, which is things like asthma, where the tubes narrow. Now, it's okay to get air in because you use negative pressure to bring the air in, but then when you try and get that air back out, you have to force it out, and that's, of course, why you have the classic wheezing sound when you've got airways narrowing. And you can get bronchitis, and you can get chronic tube or airways disease in older people, and asthma is a very classic common condition in younger people, and that's where you overreact to a stimulus and you go into excessive spasm, and that can create great difficulties. At the alveoli, where you actually have the exchange, you can get infection, a chest infection, and if it's severe and extensive, you can become pneumonia, which is a very serious condition. You can, of course, get lung cancer, and that is unfortunately a very common condition as we get older, particularly if you're a smoker. So that typically presents with coughing up blood, or perhaps a persistent cough or persistent infection, and requires evaluation by a doctor. Areas that are sometimes looked after by gynecologists and often in other circumstances looked after by dedicated surgeons are the breasts. Of course, breast cancer is an incredibly common problem for women and a very serious condition, especially in the later years. Any small breast lump should always be investigated. Remember, most breast cancers do not start off as painful lumps. They start off as small, hard, often painless little pieces of gravel or grit or something that's hard within the breast gland. If you find something like that, please get to your doctor, get a mammography, and get a diagnosis as soon as possible.